Same BMI, same weight, very different risk. And that's because when it comes to body fat, there is something we don't talk about enough. Where you carry the fat matters. The fat around your abdomen, particularly the fat surrounding your internal organs, can tell me something about your metabolic health that the bathroom scale simply cannot. Welcome to your daily health briefing. I'm Dr. Albert Takem. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. Two people walk into my office. They are the same height. They weigh exactly the same. They even have the same body mass index known as BMI. But when I look at their metabolic health, they can be completely different. One has normal blood pressure, normal blood sugar, normal triglycerides, and very little fat around the abdomen. The other has a large waist circumference, fatty liver, prediabetes, high triglycerides, and hypertension. Same BMI, same weight, very different risk. And that's because when it comes to body fat, there is something we don't talk about enough. Where you carry the fat matters. The fat around your abdomen, particularly the fat surrounding your internal organs, can tell me something about your metabolic health that the bathroom scale simply cannot. And this is why I sometimes surprise patients when they come into my office focused entirely on what the scale says. A patient, let's call her Sharon, would tell me, "Doctor, I only need to lose 10 pounds. And I say, "Well, maybe, but let me look at the rest of you. What's your waist circumference? What's your blood pressure? What's your A1C? What are your triglycerides? Do you have fatty liver? How active are you? How much muscle do you have?" Because I don't treat a scale. I treat the person standing on it. And the opposite happens too. Somebody loses 25 pounds and says, "I'm still overweight according to BMI. I failed." I say, hold on. Your waist is 6 inches smaller. Your A1C went from 6.2 to 5.6. Your blood pressure improved. Your liver enzymes improved. You are exercising 4 days a week. That's not failure. That's a tremendous improvement in metabolic health. The number on the scale is only part of the story. Now let's get into the science, okay? Because the reason the waist can tell us so much comes down to the fact that all body fat isn't biologically identical. Now you have one called subcutaneous fat. That is the fat underneath your skin. That's the one you can pinch. Then you have visceral fat. That one is deeper abdominal fat surrounding your internal organs. And visceral fat is particularly important because it is metabolically active and strongly associated with insulin resistance, type 2 diabetes, abnormal cholesterol, fatty liver, and cardiovascular disease. This is why abdominal obesity has become such an important clinical marker, meaning belly fat has become a very important thing. A large body of evidence shows that waist circumference adds useful information about cardiometabolic risk beyond BMI alone. So BMI is useful, but BMI is not the whole patient. Now, I want to emphasize something. BMI isn't useless, because this is where I want to push back against something else I hear all the time and I see on TikTok. People are saying BMI is completely useless, doesn't apply to black people, doesn't apply to Asians, doesn't apply to this. It was invented by white people, blah, 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 blah. No, that is overcorrection. BMI is an inexpensive, simple population-level screening tool. If someone's BMI is 42 That gives me clinically useful information. If somebody's BMI falls from 38 to 29 after treatment, that is meaningful. The problem begins when we pretend BMI tells us everything about an individual person's health, because it doesn't. BMI doesn't directly tell me your fat distribution. It doesn't directly measure visceral fat. It doesn't distinguish muscle from fat. It does not tell me your blood pressure. It does not tell me your A1C. It does not tell me whether you have fatty liver disease. So I use BMI. I just don't stop there. Now, this is why belly fat is different. So let's get a little deeper. Visceral adipose tissue, that is visceral fat, isn't simply an inert storage tank where your body keeps extra calories, meaning it is not just a place where you dump extra calories and it does nothing. It behaves more like an active endocrine organ, meaning it behaves like your pancreas, your thyroid, and all your adrenal glands and other endocrine organs. It releases signaling molecules. It could be hormones or other chemically active molecules. It interacts with inflammatory pathways, and excess visceral adiposity, meaning excess visceral fat, is closely associated with insulin resistance. That matters because insulin resistance sits at the center of many of the diseases I see every day in clinic. Prediabetes, type 2 diabetes, high triglycerides, low HDL, fatty liver, hypertension, and ultimately increased cardiovascular risk, meaning increased risk of heart attacks and strokes. That's why when I see a patient carrying substantial weight centrally around the abdomen, I am not thinking about their physical appearance. I am thinking about physiology. And let's bring up another thing that is really prevalent now in society, because this is another place where the visceral fat conversation matters. It's called fatty liver disease. A patient may feel perfectly fine. Maybe the liver enzymes are mildly elevated. Maybe they're even normal. Then imaging shows fat accumulating in the liver. Usually we use an ultrasound. And very often, that fatty liver exists in the same metabolic neighborhood as abdominal obesity, insulin resistance, elevated triglycerides, and prediabetes. These things aren't random strangers who happen to show up at the same party. Okay, that's not how it happens. They are frequently connected. And that's why reducing excess abdominal fat can have benefits far beyond simply fitting into smaller pants. So this brings us to an important question. How do you know if you have too much fat? Now that's an excellent question, because the simplest tool is something almost everybody has access to. It's called a measuring tape. Waist circumference can provide useful information about central adiposity, meaning central fat. Traditionally, U.S. clinical thresholds associated with increased cardiometabolic risk have often been around 40 inches for men and 35 inches for women. Although ethnicity and individual circumstances do matter, and some populations develop metabolic risk at lower waist measurements. But I don't want you turning 39.9 inches into, the doctor said 40, so I am safe. And 40.1 should not be turned into, oh God, I am doomed. That's not what I'm trying to do here, because that's not how biology works. Again, these are risk markers. I'm looking at the whole picture. So this brings us to another important question. Can you actually target belly fat? Because I've had patients tell me all the time, Doc, I don't want to lose weight anywhere. I just want to lose weight around the belly. And I know the next question that's coming. Doctor, what exercise gets rid of belly fat? And this is where I am going to disappoint you again and again. People, you cannot reliably tell your body exactly where to remove fat. Doing 500 sit-ups may strengthen your abdominal muscles. That's good. But it doesn't give you a remote control that tells your body, please remove 3 pounds from directly above my belt. That's not how it works. As overall body fat decreases, visceral fat generally decreases as well. So the strategy isn't find the magical belly fat exercise or pill. The strategy is treat excess fat. Nutrition, calorie control, physical activity, resistance training, sleep, addressing alcohol, and when appropriate, evidence-based obesity treatment, including medication or bariatric surgery for selected patients. And this is where I want to be very careful because I don't want this episode to turn into another reason for people to hate their bodies. Having a belly is not a moral failure. Having obesity is not evidence that you are lazy. And I don't care whether you have visible abdominal muscles. I am your doctor, not your swimsuit photographer, okay? I am interested in what excess abdominal fat may be telling us about your health. And if you have obesity, I want you to pursue a healthier weight without becoming obsessive about perfection. We talked about muscle in another episode. Yes, preserve muscle, eat adequate protein, resistance train, but don't become so frightened of losing lean mass that you refuse to treat significant excess fat. And don't become so obsessed with BMI that you ignore every other sign that your metabolic health is improving. The goal is health. So, as we wrap up this episode, what should you actually do with this information? This is how I want you to unpack this. Number 1, know your waist circumference. You don't need to measure it every morning, please. That's unnecessary. But if you are working on your metabolic health, it's a useful number to follow over time. Secondly, know your metabolic numbers. Know your blood pressure, your A1C or your blood sugar, your triglycerides, your HDL. And depending on your situation, your clinician may evaluate your liver and other markers. Thirdly, if you need to lose weight, pursue meaningful weight loss. Don't chase perfection. Even modest weight reduction can improve metabolic risk factors. And if you have clinically significant obesity, talk to your doctor about evidence-based treatment. Fourthly, exercise, both aerobic activity and resistance training. And finally, stop judging your health by one number. Not weight alone, not BMI alone, not waist circumference alone. Put the information together. So, if you remember one thing from this episode, remember this. The scale tells you how heavy you are. It doesn't tell you the whole story of how healthy you are. BMI is useful. Waist circumference is useful. Body composition is useful. Your blood pressure is useful. Your blood sugar is useful. Your cholesterol is useful. Your physical fitness is useful. The power comes from putting them together. And if you are carrying significant excess fat around your abdomen, don't panic. Just do something about it. Improve your nutrition, exercise, lose weight if you need to, treat obesity appropriately, and focus less on chasing the perfect number and more on building the healthiest body you can reasonably maintain. Because ultimately, I am not interested in giving you a smaller waist just so you look different. I am interested in giving you a smaller metabolic risk. I'm Dr. Albert Takem, and that's your daily brief. I will see you next episode. because the fight for your health doesn't stop here. This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Takem, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.